vaccine penetration has not taken hold, and particularly among people below the age of 60. It seems that the older members of the US population, no matter which state they live in, no matter whether it's red or blue state, they're getting vaccinated, but the younger folks feel invulnerable. So we're encouraging everybody who can find their way to get vaccinated to do so, particularly with the Delta variant exploding across the world. It's just a really important thing to do. So we are joining now YouTube Live, Twitter Live, and Facebook Live. And as soon as that is completed, we'll start the show. Thank you all so much for coming, and please do contribute any questions. We'll try to get to them. So we're still waiting for the live streaming. Here we go. So let's get the show on the road. Thank you so much. Welcome to the Nonprofit Report, your weekly update on nonprofit organizations, issues, and leaders. I'm your host, Mark Oppenheim, and today we'll be placing a spotlight on organizations that help make housing accessible to all, with special guests, Philip Hecht, President and CEO of Housing Up in Washington, D.C., Devlin, President and CEO of Families in Transition in New Hampshire, and Rob Cramp, Executive Director of Housing for Homeless in Florida. So it's just great to have you on. A reminder to Zoom attendees that we would take 3 snap polls during the show, and we'll announce results, and questions submitted to the Q&A function at the bottom of your screen will be included in our discussion. So Philip, let me just set you up. We're going to start with you, and then we're going to go around the room. There are so many individuals and families in America who don't have a place to call home, with more than 500,000 people across the United States experiencing homelessness on any given night, according to the National Alliance to End Homelessness. So let's talk about the picture from each of these parts of America. And starting with you, Philip, could you just paint a picture of homelessness in our nation's capital, in the greater Washington, D.C. area?
Well, good morning, everyone, and thank you, Mark, for this opportunity. The picture in the District of Columbia is actually fairly bright. There is a decrease from 2020 into 2021, about a 20% decrease in the number of homeless individuals. There are now 5,111 as of the early part of 2021. The number of families who are homeless in the district has dropped about 50% between the year 2020 and today. There were almost 4,000 families in 2020 who were homeless, and there are now 1,240 families this year. The reason for that, there are many reasons, but the federal government and the district government have taken actions during the pandemic. I'm sure everybody's heard about the moratorium on evictions. That has helped a little bit, but the eviction moratorium is going to be ending, at least federally, at the end of this month. The end of July. On a positive note, too, the District of Columbia is, I think, unique in its dedication to provide money for affordable housing. Mayor Muriel Bowser has a goal of 36,000 more units, apartment units in the district by 2025, 12,000 of which are meant to be affordable. The district's budget for this year includes $400 million in affordable housing support, $42 million for vouchers for people who are needing that subsidy. But this is important in the district and probably elsewhere, because more than 60% of our low-income renters are cost burdened, spending more than 30% of their income on their rent. So today I can say that trending is in the right direction, but I'm afraid that the moratorium on evictions, when it ends, will cause an avalanche of new homelessness.
And Maria, in New Hampshire, are you also benefiting from the moratorium on evictions? What is the picture looking like for you, 2021, compared to the recent past years?
Yeah, good morning. Thank you, Mark, for having us here. And Philip painted a great picture. We are seeing the same types of delay in some homelessness because of the eviction moratorium. Unfortunately, New Hampshire has actually seen a 20% increase in our homeless population. New Hampshire is a small state, so 20% is a lot for us. And we're looking at over 4,000 individuals throughout the state of New Hampshire who were captured in the point of time count who are homeless. We definitely are seeing many more families who are homeless. We have a wait list currently for our family shelters of about 37 families. And the homeless individual population that we have in Manchester, the biggest city in New Hampshire, we have a number of individuals who are in camps throughout the city, and finding permanent housing for them is certainly a challenge.
How does it look in Florida, Rob?
Well, it's hard to sum up the whole state, so I'll focus on the county that we're in. It's small, it's called Brevard. It covers the Canaveral area, so it's relatively prosperous, particularly with the growth, the resurgence, if you like, of the private space industry. You're talking about a population of 600,000, and our homeless population is about 1,200, and it's kind of holding steady. One big concern, because there are so many people moving in to the county, is a lack of affordable housing. There's a group works out of the University of Florida called Schimberg, and every 3 years or so, they do an analysis of the gap between supply and demand for affordable housing. And the lack of affordable housing is stunning. In the last 3 years, people earning under 30% AMI, which is around about 25,000, the gap between what was available and what they need went up by 40%. And people earning more, going up to 40% AMI, let's talk about 30,000 as a family. The lack of the gap between supply and demand has tripled in 3 years. So clearly, the problem's not going away. Affordable housing becomes a bigger and bigger issue.
Can we talk about this from a income perspective? Because so often the response is housing issues reduce when government spends more on affordable housing, or when there are more affordable housing units built. But it does seem, for as long as I've been alive, we've had a really big housing issue. And it seems to expand, particularly in areas where wealth concentrates and poverty also concentrates. What is going on here in terms of our housing issue? Could we talk a little bit about who are the homeless? Are these people who have jobs, who are working? Are they people who are unemployed for various reasons, who have certain needs that make them susceptible to being homeless? Philip, could you just paint a picture of who we're talking about when we're talking about people who are homeless?
Sure. I think all the factors, Mark, that you mentioned are at play, at least in the District of Columbia, in leading to homelessness. I think it might be more of an issue here in the district. We have a little bit more than 700,000 residents of the district. It's about 50% Black, probably 20% Hispanic. And those populations, perhaps always, but especially today, have been disproportionately affected. Affordable housing is the challenge.
Is this about the alignment of wealth to race in this country?
I would say 100%, 1,000%, yes. But it is exacerbated by the fact that the prices for housing in the district have gone through the roof. We can't expand our borders. We can't annex a suburb. So the district, at least as a polity, is stuck with the size of the district that we have. So we are always going to have, I think, a higher concentration and a greater disparity between the haves and the have-nots. But the racial disparity between income and wealth is only getting worse. But all the factors you mentioned, I think, are at play in what is making the homelessness problem continue.
I can throw in a metric to support Philip on that. In our county, the African American population is 9% overall county. The homeless population, 40% of it is African American.
And Rob, is this also aligned to income primarily, or are there other factors?
No, it's mostly income. I think we have to talk more about homelessness as a symptom of poverty. You get more poverty, you get homelessness. You know, if you're looking nationally, out of 22 OECD countries, we have the highest percentage of our citizens living below the poverty line, 28,000 for family of 4. That's 17%, 21% for children. So every 1 in 5 children in this country lives in poverty. That drives homelessness.
And in terms of, Maria, in terms of the question that Rob is begging, this whole idea of poverty, is there also an issue with the wealth gap? In other words, the unequal distribution of wealth, in that it seems that as we concentrate wealth and we end up with people who are very, very prosperous, it seems that the price we are constantly paying are people almost in equal proportion, right? Who are thrown into poverty. And as a matter of fact, it seems that fewer people become very wealthy in proportion to more people are becoming very poor.
Yes, I think we're seeing that throughout the entire country. Here in New Hampshire, the way that is showing up is for someone who's making a minimum wage, in order to have a 2-bedroom apartment, they would have to work over 120 hours a week in order to have a 2-bedroom apartment. Here in New Hampshire, a 2-bedroom is about $1,400, and that outprices even people who are working those minimum wage jobs. Here in New Hampshire, we're lower than maybe other parts of the country, so that is a factor. So Mark, when you talk about, are there people who are homeless who are working? The answer is yes. We are working with people who are living in camps or within our adult shelter or in our family shelter. They're working, but they're working very minimal jobs. And the price of an affordable a place to live is just completely outpriced for them. And that's a huge issue. And when it comes to development of affordable housing, most developers want to develop condos and homes that are going to bring in, as we know, people who are going to pay the highest price. And so it becomes much more difficult to develop affordable housing. And for our population, we are talking the lowest income people who need the housing.
It's interesting. We just finished a poll, Maria, where we asked, have you or anyone you know benefited from or provided affordable housing services? 56% of the people who responded said that they had, 44% said that they haven't. But we've all actually experienced homelessness, if only by walking by somebody who is quite obviously homeless. How do we deal with the issue? It seems that we're constantly chasing a solution here for a problem that it seems that we're also collaborating as a country on making worse. And Philip, you talked about the district's dedication to, through its tax policies and its revenue policies, to funding affordable housing units. Is the solution to continue to basically use tax dollars to create housing units, or are there other more fundamental solutions that we can settle on as a society that will prevent the problem from metastasizing as it has?
I think that the short answer is yes. Money is
so it's both. It's
availability of money to build more affordable housing is important. I would say that the district is ahead of most other jurisdictions in the commitment that it has made, with $400 million going into what we call the Housing Production Trust Fund to enable developers like Housing Up to do more affordable housing. There are certainly other solutions, but as a housing first organization, we believe that housing is a right that everybody has. And until people are safely and comfortably housed, the other issues that need to be addressed are likely to fall by the wayside. At least that's what we have found.
And Maria, how do you see it? Are there approaches that we could take to prevent this issue from metastasizing as a society?
I'd love to say yes, although I'm not sure we're there yet as a society. What we're seeing in New Hampshire, I think we're all seeing as we talk about the fact that our borders can't get any bigger. New Hampshire is New Hampshire. Each of our towns and cities is its own little boundary. And each town and city has to come up with their own plan on what they want to do to help make their town more affordable for people to live in. I think, we do have a NIMBYism here across the country. People don't want people who are extremely low income living in their neighborhoods. And so there has to be a lot of education on why it's important to have mixed neighborhoods where everyone can thrive and everyone is lifted up. I think too, of course, it comes down to money, and there's housing money. There's lots of government programs currently going on that can help organizations like the three of us here today in a number of different ways. But what it really comes down to, Mark, is the long-term kind of operational costs of those buildings over time. I heard Rob say earlier they're expanding by a tremendous amount. We're a much smaller organization than Housing for the Homeless where he is. But the cost of owning and operating these buildings, providing the supportive services that these families and individuals need over time is extremely expensive. And that's where the philanthropic part of our work also is critically important. So it does come down to money, and the streams of money have to be very wide and long-term.
We just completed a poll, Rob, in which Maria's point, which I'll shoot over to you, is emphasized. 43% of people said, when asked, do you believe affordable housing enables individuals and neighborhoods to stabilize and overcome other challenges? 43% said yes, if housing were more affordable and stable, and that alone will make a huge difference. 57% said, really, housing needs to come with support. And that kind of emphasizes the point that Maria made. Rob, what is your experience in Florida?
It varies a lot in Florida. So it's hard, it's a very big state. You have major homeless problems in big cities like Orlando and Miami, Miami-Dade as well, although they're doing a lot really to do. But it comes back again to affordable housing. Interesting your comment though about housing, not just affordable housing, but the presence of a house itself. 60% of homeless people nationally suffer from mental health problems or substance abuse problems. And you cannot effectively treat those problems unless they're in stable housing. So that, it's not just a question of housing, it's creating a stable atmosphere that these people can get treatment for. And the problem is, even when they get into the housing, there usually isn't enough money so even when we're providing this housing, we feel like we're kicking the can down the road because these people are leaving our housing at the end of a program, and they're not much better off than when they left. They've stabilized their life, they're able to move on, but they still retain the same mental health problems, the same substance abuse problems that kind of contributed to the problem in the first place.
Mark, if I could just add to that, I think that supportive housing is where we are. We've always been that way for the last 30 years. We don't just provide an apartment, we provide case management services, resident services, connection to various either medical services or mental health services for all of our clients. But unless you have that two-step or multifaceted approach, I think you're going to end up like Rob with families that or individuals who do not move forward.
So what you all seem to be saying is that it's not just, and we did get a question from Stephanie, isn't finding land to build and so on a barrier, or acquiring housing a barrier? What you all seem to be saying is that really it's the acquisition of housing and being able to provide that, but it's really a baseline required, and this goes to your point, Rob, for also addressing other needs. So are we under investing? If you look at society, You could take a Darwinian approach in which you say survival of the fittest, devil take the hindmost, right? If you can't hack it, you'll be left behind, right? You can also create a nanny state. And there seems to be a false choice between those two bookends, those two extremes. But I think there might be a case to be made that we're not really investing a sufficient amount of our very rich resource in ensuring that so many people are not marginalized. Do you all have a view on this? Because this whole issue of shaping language to prevent solutions, basically characterizing things as income redistribution or others as being heartless, it just seems to miss the point. We don't get to solve anything if we're not talking about it. Philip, you want to give a cut of this?
I may not subscribe to this, what I'm going to say fully, but I think the economics of providing housing and supportive services is literally cheaper than maintaining homelessness or ignoring homelessness like some want to do. The number of hospital visits, the number of emergency medical events that take place when people are on the street or in shelter is far greater and far more expensive to deal with than if they were housed. I'm not saying the issue goes away or it's completely solved, but I think that the economics that I've read suggest hospitals are now supporting it more than they ever would, because there are health connections between being homeless and being sick, or homelessness and reporting to the emergency room. So there's that pure economic argument over and above the ethical argument that I would support.
Rob, how do you see it?
Yeah, it's, in our county, we did an analysis 3 years ago. The cost of homelessness, we're a small county with 600,000 population. The cost of homelessness per year was $28 million. And 22 million of that was through healthcare, through the hospitals, a lot of it emergency room. But it's very difficult to get into a responsible dialogue, if you like, with the hospital population, because they have their own challenges there. But it's definitely an economic bleed. But you have to get everybody. It's no use blaming it on the hospital. They do whatever's necessary to keep people well, and then they have to spend the money. It's getting the county commissioners. It's getting the whole government lined up behind the cost, and what can we do to drive it down?
I always love a state whose motto is "Live free or die." Maria, how do you see it from the New Hampshire perspective? Because New Hampshireites are notoriously stiff back when it comes to individual liberty, and the whole idea of state intervention. And as you said, every municipality has its own sensibility in New Hampshire. How is it actually seen in your state, this issue of addressing homelessness in a way that just makes sense, right? Because New Hampshireites are also very, very practical folks.
We are very practical, and being here my entire life, that's completely true. One of the things that I think is really exciting is here in New Hampshire, our governor did create recently a council on housing stability, very much along the lines as Philip was talking about. The government actually making a plan and a strategy to determine how we're going to move forward. And a lot of the things we talked about today are in that plan. 13,000 new units in the next couple of years between now and 2024, I think. And that'll help some. But we also see small increments in our population just continuing to increase. And I think, as we talked about that, the differences in wages between our highest paid and our lowest paid. In New Hampshire, tourism is our biggest money maker. That and state employees are our two biggest kind of markets of where people get their income from. And that means a lot of people are barely making minimum wage. And that work cycles. And with the pandemic, you talked about it earlier, in regards to COVID and where the numbers are, but small states like ours is going to have a hard time kind of rebounding. And we know our tourist industry has been hit extremely hard. So that's going to continue to hurt the people who may be safe right now when the eviction moratorium is on. But as soon as that is lifted, our fear is that we're going to see a rise in homelessness in 2021.
So is part of the issue that, I don't know who mentioned it, but you were talking about the working poor as well. Is part of the issue trying to provide some supportive services for the 60% who are homelessness, who need additional support, mental health support, addiction recovery, and so on and so forth? Is part of the issue also a question of grappling with what is living wage? You know, as our jobs are being exported to places where the wage is $1 a day, right? I mean, how do you compete against that, right? How do you make sure that there is dignity in work, and that also we are paying for the quality of life of people who labor to make our products, right? As consumers, how do you see this? Because, you know, on the one hand, you can end up with a totally overregulated regimen, right, where the free market can't actually operate. On the other hand, if you just allow for Darwinian structures, then what happens is fewer and fewer people prosper, and there are masses of people who just don't. Rob, how do you see this?
Well, I think first of all, I think you have to start off with the tax system. You know, we're supposed to have a progressive tax system. We don't. We have a regressive tax system. That's why Warren Buffett says he pays less a percentage of his income in tax than his secretary does, because our system, unlike almost all Western countries, our tax system is built on deduction. And if you don't earn it, how can you deduct it? So we have to get out of the deduction cycle to enable people not to just to earn it, but to hold on to it. They pay more of their tax than anybody else does, the poor do. I think that is the other one in terms of breaking the cycle while we're staying on taxes is we, more than any other country, use property taxes to pay for local education. So the rich get funded, better funded schools. And so the cycle continues.
If I could just pick up on that, I was told by one board member a long time ago, my board member, that in fact, those of us who own houses get a bigger tax break than anybody because of the mortgage deduction. And I think if you can convince people of that or remind people of that, it's not as if those of us who own houses and are prosperous aren't supported by the government or don't need the government. We all do. So we're not a class apart. We all need the same support.
So your point here, Philip, is that so often these debates are really not about equity at all, or income redistribution, or any of that. It's really about, and I hate to use the vernacular, but whose snout is in the trough, right? I mean, if the people who are wealthy are tilting things so that they actually get the greatest benefit, then
and I think it's a racial equity issue for sure. And Housing Up, and I'm sure your other organizations are aware of that and working hard. But I think that's the more fundamental underlying challenge.
Maria, we're going to give you the last word since we're coming to the end of our time. I just wanted to note we just finished another poll, really interesting results. The question was, the need for affordable housing is immense. How should America address that need? And the response was really interesting. 78% said cities must supply more affordable housing. And then that was followed by stipends to landlords for providing housing to low-income tenants, right? So you've got both the supply and demand side being addressed. You have a combination of a private response and also a government-led funding. Maria, how do you see long-term us trying to solve this issue?
Well, I think for us, it's going to take everyone kind of coming together to determine what happens next, right? It's going to take our government partners, it's going to take our town partners, as well as just our state government. I love the fact that someone brought up the landlords. That's a big piece of this. Families in transition, for example, is not going to be able to build the number of units needed in the amount of time needed. So landlords need to be interested, willing, and open to at least having the conversation of accepting a voucher, of working with us and other organizations who can help stabilize the people that we work with. That's a critical piece of this work. It is going to be a long time till New Hampshire gets out of or feels like we see the light at the end of the tunnel. 13,000 units for us is a lot of units to build throughout the state. And that's going to take some time.
I think that the points that you're all making are so important that really it's an all-in kind of a problem that we all need to consider. There is no correct answer to this. There is a problem. It affects us all. It doesn't matter if you're the wealthiest of the wealthy or the poorest of the poor, in that we are all part of this country. And homelessness and this type of level of homelessness throughout our communities, whether it's in New Hampshire or Florida or in our nation's capital, it really is a drag on American civil society that we need to resolve. Philip Hecht, President and CEO of Housing Up in DC, Maria Devlin, President and CEO of Families in Transition in New Hampshire, and Rob Cramp, Executive Director of Housing for Homeless in Florida. Thank you so much. Thank your staff, thank your boards, thank your funders for your great work. And that's the nonprofit report. We're going to take a 2-week hiatus, then we'll be back to be talking about performing arts organizations emerging from the pandemic. And then we'll also be planning a show on teaching history in the United States, another topic that is fraught with debate. Thank you all for helping us understand the issues of homelessness and affordable housing in the United States.
Thank you.
Thank you.